Rochelle Goldberg. I'm with Mainline Health, and my titles are Director of our Paoli Sleep Medicine facility, and I'm also the System Chief for Mainline Health for the sleep field and the sleep practices. Very excited to talk about sleep as part of the Essential 8. Thrilled, as was most of the sleep community, when we finally got a spot on the chart. There's just so much that sleep and health overall interact that it's hard to come up with something that doesn't get affected by sleep, and how some of our other health issues might impact sleep in the opposite direction. One is cardiovascular disease on multiple levels, including heart failure, the risk for heart attacks, the risk for rhythm problems. The probably second highlight would be hypertension, diabetes. How obesity and sleep interact is also an underappreciated concern. The first step is to accept, at least intellectually, that sleep is actually a critical part of our lives. Our societies are so busy and everyone feels so overwhelmed most of the time that the unfortunate view of sleep being more of a negotiable thing, if I stay up longer, I'll get more done, is quite widespread. And in fact, you become less productive the longer you're without adequate sleep. So it's also just doesn't work that way. Start with looking at the reality, which is most adults need between 7 and 8 hours of sleep. We don't like those numbers. We don't like to admit them for ourselves, but that is the scientific reality. And if you can accept that and look at your 24-hour schedule, because we always have to work within our wake time and our sleep time, right? So if you look at your 24-hour schedule and say, how do I approach fitting sleep into my 24 hours? For most people, I recommend, especially working people, you can start with, and I include, parenting as working people. You can start with, when do I need to be up in the morning? And once you know that, you can count back, preferably at least 7 hours, to figure out, this is the time that I really should be in bed. Not thinking about going to bed, but in bed. And from there, you want to count back at least 1 hour, preferably 2, because you need time to transition from being awake and busy and active and interactive to be in a place where you can actually be ready for sleep. Walking into the bedroom, putting your head on the pillow does not make sleep happen, as many people unfortunately are aware. You need time to transition from that one very active situation into sleep. So once you get in bed, of course, now that you're relaxed, the room should be cool, dark, and quiet. You don't have other activating things around you. Ideally, the bedroom should be a place that you see as a very calm, restful place. And that's okay. We sometimes have to step back and give ourselves permission to enjoy relaxing and going to bed. It's really not a punishment, I promise. I always do try to make sure that I have that time to relax. I try to finish closing all my notes when I'm done seeing patients before I'm ready to shut down and relax. Again, television is okay, reading is okay. I just think you want to look back and kind of think about, have a discussion with family about, because obviously there are other members who might be pushing for different things, that this is all a good time for family. It's a good time for couples. It's a good time for us just to really take that break together, which is what I try to practice as well, to really have that safety net